Let's frame that up a little bit. You're good to go.
Hello, everyone. Welcome to our family meeting. I know it's been a while since we've had one, but we have a fair bit of news we want to share with you. So welcome, and I'll get right into it. So the first thing I want to do is talk about the new changes that have occurred in regards to visiting. So we have a policy on resuming visits during pandemic restrictions. I'm reading to you from the 13th and 14th revision. We now have 2.5 pages of footnotes, so it's 2.5 pages of footnotes. Sure. So it's very detailed, and there's a lot of different governing bodies that we have to take into consideration: medical officer of health, the minister's directive, long-term care, the Simcoe Muskoka District Health Unit. So I just thought I would try to highlight the changes with you today. So as you may have heard, the Ford government announced that outdoor visits would begin again effective last Saturday, May the 22nd. Unfortunately, they didn't send us the directive until May 22nd. So as I mentioned in my email to you, what I sent out on Wednesday, that we are now scheduling outdoor visits. And I think we had our first one today, but it was a bit chilly. So also want to make a note to essential caregivers that Simcoe Muskoka District Health Unit has information on getting your COVID vaccine. Essential caregivers are eligible to receive a second dose. So if you haven't, in a shortened interval, so if you haven't had your second dose and you're an essential caregiver, you can contact the health unit. Also, that if we have a number of new residents who now joined us during the worst part of the pandemic, we actually had 5 empty private rooms that we kept for isolation in case we had a COVID outbreak. We've now been informed that we have to begin filling those beds. So we have about, I think, 4 or 5 new residents. So welcome to the family members if you're joining us for the first time. If you decide you want to be an essential caregiver, there is training that you have to take in relation to infection practices, IPAC, infection control practices. And the person to contact would be Amy, who's interpreting for me. What she would do is set up for the staff to come and train you in what you need to know if you're coming in as an essential caregiver. We have copies of the policy at the front. I also do email out copies of the policy, and we encourage you to read it, and we will let you know when there are changes to it. We just want to remind you that you, when you're coming in, you must only visit the resident that you are intended to visit and no other resident. And that we do reserve the right to determine the frequency and duration of all visits, all dependent upon our ability to facilitate them. We are still not providing meals because of COVID. You may wish to bring in a beverage to share with your loved one, but the container must be wiped with a disinfectant prior to going into the home and giving it to them. And please note that visitors or essential caregivers are not permitted to bring in food or drink for themselves while visiting the resident, because we do expect you to keep your mask on, even if you've been fully vaccinated. No pets are still not allowed in. Everyone coming into the building, and even those who are going to be doing outside visits, must be actively screened. They must answer the questions. People who are coming for outdoor visits will not need to be tested, so you won't need to have an antigen test, but you will need to be screened. If you don't pass the screening, then you will not be allowed to come in and have the visit. Contact information for making arrangements for your outdoor visit, and the virtual visits are going to continue. General visitors. So a general visitor is someone that's right now doing an outside visit. We're assuming in a week or two, general visitors will probably mean indoor and outdoor visits, as things are quickly changing. So general visitors are required to pre-arrange their outdoor visit with Amy. BRHD will continue to provide virtual and or window visiting options, phone calls, Skype, FaceTime, etc., when it is not possible or advisable for in-person visits, i.e. if the weather is inclement, then you may have booked an outside visit, but because of the weather, that's not going to happen, then you could change that to a window visit. You can contact Amy Monday, Tuesday, Thursday, and Friday from 9:30 to 4:30. Just call our number, and her extension is 309. On Wednesdays, you can contact Jen Pilon at extension 308.
So, just remind people of the Q&A.
If you have any questions, please put them in the chat box, and I will respond to them as we go along or at the end. So I mentioned general visitors, which right now really means outdoor visitors. However, the minister's taken away outdoor and indoor visitors like we used to have last year, and they're just now called general visitors. So a general visitor is someone who's not an essential caregiver. So access to BRHD for general visitors, you can have a maximum of 2 general visitors per resident at the outdoor visit, as long as the resident is not self-isolating or symptomatic and the resident is not living in an outbreak area of the home. And also the caregiver, up to maximum of 2, may also be present. No, the caregiver is only 1 caregiver coming in at a time. So if the caregiver, essential caregiver, was in visiting with mom, dad, whoever, and then there was a outdoor visit booked, the essential caregiver can join the outdoor visitors. So you might end up with 4 to a maximum of 5 people, which is what the province is allowing right now, of groups of 5 being able to congregate outdoors. No general visitors are permitted indoors. General visitors younger than 14 years of age must be accompanied by an adult and must follow all the applicable health measures that we have in place. Children under the age of 2 do not count in the total numbers, so they can come and they don't need to wear a face mask, and that way people get to see hopefully their great-grandchildren. So we do require that you pre-arrange your outdoor visit. The visits are a minimum, and it's up to you, but we have to give you a minimum of 60 minutes. If you call Amy and you think, I'm not going to spend a whole hour, I'm only going to take 30 minutes, let her know, because then we can book somebody else in after that. But we will have an hour space for you. The visits will be scheduled Monday to Sunday, 9:30, 10:30, 1 o'clock, 2:15, and 3:30. The times are in the policy that I sent you on Wednesday, so you can look it up. Wednesday evenings, there's a time slot from 6 to 7. We are conducting the outdoor visits in the main courtyard, and we can set up 3 to 4 visiting areas. We're not putting up the visitation booths. we're just putting people in a shaded area. You have to remain 6 feet apart from the resident, and they'll put the chairs there so that you're able to do that. The policy also says that we will make every effort to provide a minimum of 1 visit per resident per week with up to 2 general visitors. If we were to take the time slots and multiply them by the number of residents, it would allow for 35 visits. It would allow for 3 visits per resident. So, and then I know per week, yeah. So I've mentioned that the vocation is in the center courtyard. All of this information, again, is in the policy. I'm just going to go to visitor testing during non-outbreak times. So if someone was coming into the home, they would have to be tested, and we have rapid antigen testing, which we do in the chalet. So before anybody is allowed past the doors to go into the home, they have to be screened, and then they have to follow the testing protocol. So our week starts on a Sunday and ends on a Saturday. And so basically people are being tested every other day. So it gets a little complicated when you start looking at how many times the person is coming into the home. So within the policy, there's kind of an algorithm that has been made a little bit easier, where you can go to it and say, for example, testing for caregivers. So this would be the question that you would be looking at. Have you previously had COVID-19 and were cleared by public health? If your answer is yes, no test is required unless you've been exposed to another outbreak. If your answer is no, then you continue down to the next question is, do you work? It's changed again. Of course it has. So I did get the 14th version of the policy about an hour ago. And I thought, okay, so I'm going to go to that page. And I'm going to go to testing for caregivers. Okay, so the testing for caregivers is the same testing that our staff receive. So the first question is the same. Have you had COVID previously? If your answer is yes, no test is required unless you're exposed to COVID-19 or an outbreak. If you're no, then you continue down, and have you worked or visited on any shifts this week? If no, the antigen test is required. If yes, you follow the directions as per prevalence of COVID-19 in the area. There's high and low. So there's no definition for high, and there's really no definition for low. So this is something you probably do want to read. So if the prevalence of COVID-19 is prevalent and it's high in our area, provide proof of a negative COVID PCR test taken in the last 7 days. And that's the test that you would go to Sperling Drive or wherever to get. That's not a test that we do here. So you'd have to provide that, plus you'd have to have 1 antigen test on a separate day within the 7 days. Or if you're only visiting 2 days that week, you would have an antigen test on both days. If you're working or visiting 3 or more days, then you have to have 2 to 3 antigen tests with at least 1 day in between. I know it sounds really complicated, but we would figure it out for you so you don't have to do the math. If the prevalence of COVID in our area is low, you could provide a COVID-19 PCR test within the last 7 days and have 1 separate antigen test on a separate day within the 7 days. If you're only working 2 consecutive days that week, you have an antigen test on the first work day, and you don't need an antigen test on the second day. That's the difference between high and low. if you're working or visiting 2 non-consecutive days or more than 2 days that week, you have a total of 2 antigen tests in the week, at least 1 day apart. I hope that's clear because I have to give it some thought too, and I'm not sure how well Amy did on interpreting that. So, yeah, we don't make this up. The ministry does, to be clear. So, testing for general visitors, right now you're going outdoors, so you don't have to worry about trying to figure it out because all you need to do is pass the screening. You don't have to have a test. That could change next week. I just want to remind people, and we really haven't had any issues over the last 14, 15 months, so I thank each and every family member. Adherence to our policy is very important. As you all know, we've had no outbreaks. We had a little scare last month when we had a suspect outbreak, but it turned out to be nothing. So we can say that we have been COVID-free so far. And part of that is the fact that everybody has been respectful and followed the policies. The residents have been amazing. The staff have been good, and the families have been outstanding. So thank you for that. But please do remember that the screeners, even though they're young, they know their stuff, and they will ask you the questions, and they will tell you what you can and cannot do. So I just thank you for that in advance for your cooperation. There is a change in reporting. So if you were to come in and have an antigen test and it showed positive, we would obviously send you home and would strongly encourage you to go and get a PCR test. However, we no longer have to report the positive antigen test to Simcoe Muskoka District Health Unit. But again, we would be monitoring you in terms of, did you go? Because if you get a positive antigen, you really need to go and get a PCR test. It may be negative, but it also may be positive. So that's the change in our reporting. And then there's lots of information and definitions, and there's a list of appendices with IPAC training that you can go online. There's also the symptoms are laid out very nicely for you to look at. I'm sure you probably all know what they are. There's 4 moments of hand hygiene. There's donning and doffing of your PPE. And like I said, there's 2.5, almost 3 pages of footnotes. So that is the visitor policy. Big change is outdoor visits for people. And that's going to be really very weather dependent. And June 2nd is next week, so I might be seeing you again next week. So were there any questions, or should I just continue on, Derek? Okay. So I wanted to share some other news other than just policy changes. This is from the Ministry of Health, and it's in relation to co-payment. So it's about what the residents are charged by the ministry to live here. So I'm just going to read the first part of the memo that they've sent out to us. During the pandemic, our government, which is the government speaking, wants residents of long-term care homes and their families to focus on care and comfort, not money. That's why Ontario is extending the freeze on the annual rate increase to long-term care residents co-payment, and that's scheduled from July 1st, 2021 to January 2022. So normally Jen Pilon would be contacting people to get to see about rate reduction. So that's not going to be happening. Everything's frozen. It's going to remain the same. So whatever you're paying now will continue until such time as the ministry tells us otherwise. And as you know, when you come in, I'm not sure that, of course, everybody's not coming in, but this, no, Derek, this is posted. It's like, no, it's not. It looks upside down, but it's not. It's just, anyway, this is posted in the home, and maybe what I'll do is send it out to you, and it's the bulletin to residents of long-term care homes, important news regarding long-term care home accommodation charges. So we will be sending out the billing at the end of this month. I will make sure that this is included so you can see that the rates remain the same and what the rates are. And again, this is all determined by the Ministry of Long-Term Care. So I wanted to share with you vaccinations of staff. As you know, when we had our vaccination clinic for residents, we had 93% of our residents vaccinated. We've had some new residents move in, so I'm not quite sure what that percentage is because some have had 2 vaccines, some have not, depending on where they're coming from, hospital, community, other homes. So I can share that with you when I have it. So by today, the home will have a 75% vaccination rate for staff, and that means staff with second doses. In addition, 13 staff have had their first dose and are awaiting their second. Once they have their second dose, we'll have an 89% staff rate of vaccinations, and that's really good. So I'm glad to share that news with you. And again, I wanted to share with you the changes in staffing. So summer sort of here, and we've hired 6 PSW nursing students in May. So that's good news. And then we have another one starting in June. So now we're down to 1 RCA, resident care assistant, but we applied for last year and received 6 summer students. 2 of those will be resident care assistants, and there'll be 1 on Care Center 1 and 1 on Care Center 2. There'll be 2 activity students working with our activities. 1 will work on Care Center 1 and 1 will work on Care Center 2. There's 1 landscaping position and 1 front desk position. So that will help us with our visitation. So that's 6 students that we have for 8 weeks, which is always really helpful for us. Okay. And my last bit of news, you may have heard because, of course, the government announced it, both Andrea Kanjan and Bassard, what's his name? John Bassard announced that the home, so we applied for this and we were awarded $3.1 million to upgrade our HVAC system. So in the news of over the past year and especially last summer, there was a lot of talk about certain homes which didn't have air conditioning in resident rooms. Our building is 15 years old, so our HVAC system has a lifespan of 15 years, and we have air conditioning in all the public areas, and we have tempered air in the resident rooms. The ministry has passed regulation that all resident rooms in long-term care homes must have air conditioning. So with this $3.1 million, we're going to be able to replace all of our HVAC system. Let's look at a list here of what we asked for. Duct cleaning, domestic hot water upgrades, separate air distribution centers to prevent cross air circulating. So it's going to be obviously a much better system in terms of pandemics. Ability to operate at 100% outdoor air and incorporating ionization technology, modifying duct systems to minimize the spread of aerosols, replacing 8 rooftop units, HVAC air distribution systems. So that work we should start that soon. We were initially told that we had to have the job completed by the end of the summer. However, we didn't receive approval until April, and then we received a letter, but no more information until May. So now they've decided that they're going to give us until 2023. It is a bilateral agreement with both the federal and the provincial government. So it hasn't been changed with the federal government. So the 2021 date still stands until they change the agreement. And then hopefully we'll have this complete by 2022. That's kind of what we're aiming for. So, and I don't think that should be too disruptive for our residents because it's all going to be taking place outside, I guess. I don't really know. But we're very excited that we were awarded the $3.1 million. Prior to receiving word on this, we did receive some minor capital funding, which was to go, which all homes got, which was to go toward air conditioning in the resident rooms. We're now able to take that money and use it for infection control purposes. As some of you know, and have been in the home, that we were able to replace all the carpeting in the hallways with tile floor. So we will take this money and put it towards improvements within the home in terms of infection control purposes. So yeah, so that's a little bit of an exciting news for us. And I don't think I have anything else. So I'm happy to answer any questions you may have or attempt to. Derek, no questions? Oh. Again, I just want to thank you for all that you guys have done over the past 15 months. All of the lovely goodies that you've provided to the staff have really helped with staff morale. Thank you. Just, being cooperative and supporting us has meant the world to us. So thank you. And there's no questions. There's a bit of lag time. So just wait another minute. Yeah, I did talk about the suspect outbreak and the fact that, so what that means is we had a staff person who tested positive. And because she tested positive, the public health said that we were on suspect outbreak. So we went into full outbreak mode. Everybody did everything that they would have done if we had actually had an outbreak. And we had a mock outbreak. So it was actually a great exercise. So there were about 5 days where we're all holding our breath and doing everything that we would have done if we had an outbreak. And then on the Monday, we got the call saying there's no outbreak. The suspect outbreak means nothing. So then we were able to go back to where we were. So sorry, what am I looking? Oh, question. Yeah, Sandy Tarn, thank you. As family members, we appreciate all you are doing. Oh, you are most welcome. It's our privilege to take care of your family members. So that's what we thank you. I will let the staff know. Is anybody actually watching this?
Thanking people.
Oh, that's all. Oh.
You're caught up.
Okay. Well, if that's all, I say thank you. Tune in for the next announcement. And please remember, if Mr. Ford gets up and tells you you can go in to your loved one's home tomorrow and hug and kiss them, just give us a little bit of time to get things in place before you're asking us to do that. Because more often than not, it is a political announcement that he makes, and then we wait because we have to have direction from the Ministry of Long-Term Care in a directive, a written directive, and that often doesn't come. And sometimes it comes and they attach the wrong directive, which is what happened on the weekend. They sent an old directive, so then we had to wait for them to fix that and send a new one. So, and as soon as we can, and as soon as we get the information, we try to put things into place. So, thank you. And stay safe. Hope to see you all soon when we can have a big party.